Now we are moving to the English session. Today is our 1881st day of continuous webinar. Welcome all the participants for today's session. Before beginning the session, as usual, our silent prayer. Good evening and welcome once again. Thank you all the participants for joining with us. Today's our guest is Dr. Hubert De Silva. There is no need of any introduction. For us, some days we are changing the role to host, and some days we are playing the role of moderators, and sometimes the role of guest. So today he is playing the role of a speaker, and I am inviting. He has 35 years of experience. He is IFPH moderator, and he's successfully running a clinic in Karakuttam, Trivandrum. And he is our music therapist. And today our topic is management of neurological disorder. I am inviting Dr. Hubert De Silva. He is M.Sc and BHMS. That is his qualification. And I'm inviting Dr. Hubert to deliver your session. You are welcome, Doctor. Please.
Hello, Doctor. Thank you very much for your nice words. Today, we are reaching this place. Now, we have celebrated our 5th year, and now we are approaching to the next year. So, now, today, my subject is neurological disorders, and it is a continuation of the previous one. Let me share the screen.
Yes, Doctor.
Okay, can you see me?
Yes, Doctor.
Okay. Now, this is the neurology ninth part. In scripture says that Sirach 34:14. Fear the Lord, and you will have nothing else to fear. If your trust is in Him, you will never act like a coward. People who fear the Lord are fortunate because they know where they can look for help. The Lord watches over those who love Him. He is their strong protection and firm support. He shelters them from the heat, shades them from the noonday sun, and keeps them from stumbling and falling. Sirach 34, He makes them cheerful and puts a sparkle in their eyes. He blesses them with life and health. That is what God says to us. The Creator, who created the whole world, the universe, and we also. So we have to always thankful to Him in everything. In Bhagavad Gita, it says that everything we should offer to God, Lord. That is what Raja Yoga. Everything, whatever we do, it should be sacrificed to God or offered to God. That is what we are doing for the last these years, and we are successfully going all through this path. Now, it is not a small thing. I think that I have already done 3,000 videos of IFPH. I edited it. I think that it may be a world record, a medical video in 3 languages, almost 3,000 videos. Yeah. I did with myself, with my hand. That we can see in the YouTube. So these are all the blessings of Lord. Because otherwise, nobody can do this. 3, 6. One day I did 19 videos in addition to doing all my duties. I did 19 videos because we have lots of videos are in the box. So we had to bring it all because the 1001 time it is not properly built. So in addition to that, we are doing all these things. So today we are talking about the neurology, cranial nerve diseases. Last time we've gone through some part. Now today, just to go for, there are 12 pairs of cranial nerves. We know, all of you know, olfactory, second optic, third oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal. So these are the important cranial nerves. Most of our activities are controlled by this. Any nerve of the cranial nerve having any defect, any damage, then the whole person will be distorted. We talked some about olfactory, the first nerve, olfactory nerve. That we can see here. Can you see the picture, doctor? Because I could not see you people.
Oh, you can. Yes, I can see
cranial nerves. Cranial nerves.
Yeah,
cranial
fourth
nerves
slide.
are,
yeah.
Here you can see the olfactory nerve. These are the cranial nerves are acting here and there, all the body. So we are talking about the olfactory nerve. Some we have completed, and again we can go through it. What is the important? Normally, we don't think that it is an important, because somebody says that he's not getting the smell of certain things. And we will we will take the case and we will send them back. So 2 days back, one girl came to me and she told me that nowadays, a few days, within 2 weeks, within these 2 weeks, I cannot tolerate any perfume, smell of any perfume scent. Because previously she was very much like that smell. And now she could not tolerate. She cannot tolerate it for a little while because she is having some vomiting sensation. If somebody doing these perfumes, they are using perfumes, then he may be very much irritated, and he is getting very much irritated and coming to vomiting sensations are coming. But previously not like that. So first cranial nerve, courtesy of your olfactory nerve, is the first cranial nerve. It is also the part of autonomic nervous system, which regulates body functions. This nerve enables your sense of smell. Cranial nerve one is the shortest sensory nerve in your body. This is the shortest sensory nerve. There are so many nerves are there, sensory nerves are there, but this is the smallest. But I wonder many times, because the smallest thing in our body may be the important one. The smallest gland is the pituitary gland. It controls the whole body. Here we can see that the cranial nerve, the first cranial nerve, olfactory nerve, is the shortest sensory. The length of it is very small, but it is the important thing. Here we can see this is the olfactory nerve, olfactory bulb. We can see that continuation of it. What is olfactory nerve? The olfactory nerve is a pair of cranial nerves. They transmit information from smell receptors in the nose to the brain. Nostrils are either of 2 external openings of the nasal cavity. The septum separates the 2 chambers of the nose. It is a thin bone and cartilage wall Sinuses are hollow, air-filled chambers in the bone surrounding the nose. What are the difficulties? We can see that. Here, we can see there are some cavities are there. Sinuses. Here, some collections are there. Collection here, here's some collections, and these are the collections in sinusitis. During the time of sinusitis, the partially or completely, they can lose smell. Some girls or patients, always using kerchiefs, and they will use it during the time of cold and flu or any fever or conditions. After a few days later, she will wash the kerchief and she will keep it somewhere. And we may feel, we can see that after some time she may get the same complaints will reappear. If they are treated completely, then again, whenever she is using the kerchief again, there may be chances of reinfection. Reinfection, there may be chances. So, whenever we are treating a patient for or chronic or acute cold or rhinitis, sneezing, other symptoms, we have to always say that if they are using a kerchief, it should be boiled and then only they use again. They may be completely, they have chronic sneezing and cold and rhinitis and everything. But it may be one of the reasons for such conditions. Okay? Here we can see inflammation of paranasal sinuses, which are the adherent areas it is affecting. Acute sinusitis and chronic sinusitis may be there. Frontal sinus obstruction. Here we can see that cavity, that sinus, maxillary sinus. From here, there may be some obstruction in the area. The collection will be there and it may be settled there. Sometimes it may become thicker and thicker and thicker. They will feel that some congestions are there. They will feel that pain. Sometimes there may be inflammation again and again may cause, it may come, that time they may feel pain and there is congestion. They will say that something there, so I could not. So here, Heparself lower potencies are useful and Silesia lower potencies are useful. And sometimes it may affect, the infection may go to the ears and acute suppurative otitis media, chronic suppurative otitis media, there is coming discharges from the ears, thick and painful. That time, Silesia high potency is very much useful. I have seen many cases. I use 1 arm, Silesia 1 arm. It may easily, you can clear the case. More than, higher potency more than 1,000. 1 arm. Usually these are the infection normally having. Usually viral, but secondary bacterial infection can occur. Duration less than 4 weeks. Sometimes it may continue. Headaches, fever, purulent nasal discharges. These are all things that sometimes there is a foul smell from the mouth and from the nose. Some patients having this for a long time. In such cases, we have so many medicines we have, but I think that there are 3 medicines are most important. That is Pulsatilla, Silesia, and Kali iodatum. Kali iodatum, Kali mur can be used, and natron mur. These are the major medicines we can use in the the belladonna, the other medicines for the pain and inflammation and congestion, we can use. But the chronic affections will be controlled by these four medicines. Normally, these medicines will cure most of the cases. We can see that here, the base of the brain, we can see these are the parts. They are very much closer. Each and every organs or the nerves and areas are very closer. So there is an infection in anywhere, it may go other parts. In this, even though these are how beautifully God created all these things in settled in under the base of the brain, yeah, we can see the important thing: the eyes, optic nerves, optic chiasma, and pons, medulla, and this 12 cranial nerves. Like nasal cavities, and these are up here. But whenever there is inflammation and sinusitis, inflamed lining, the lining may be inflamed, and the areas may be here, excess mucus, infection, and lower potency. I told you that the lower potency of hepatic cells is more useful, and pulsatilla 30 is useful for to clear. And in addition to that, sulfur 1,000. What is the anatomical course of the olfactory nerve? The anatomical course of the olfactory nerve describes the transmission of special sensory information from the nasal epithelium to the primary olfactory cortex of the brain, nasal epithelium. The sense of smell is detected by olfactory receptors located within the nasal epithelium. The nasal epithelium, we know that nasal epithelium, there is some epithelial cells are there. Whenever the smell, it touches the mucus of that area, and it may reach the brain. Here, reasons and symptoms of sinusitis. The sinusitis infections are, this may cause one, infection, temperature, nasal mucus, nasal congestion, itchy nose, itching inside the nose and the eyes, and facial pain. Itchy nose. I want to add one medicine. For some patients having the redness of eyes, very often they may see, we can see that redness of the eyes and itching of the eyes. Because of these, maybe these conditions or any other conditions, there may be a chronic case. In such cases, we can use Aurum Met. Aurum Met. Aurum Met is an important medicine for redness of eyes. Here and then, whenever they are after bathing, after going, sometimes there is itching of the eyes. Both eyes are reddened. In such cases, we can use Aurum Met Ona. In addition to that, chills, itchy nose, infection, sinus, and rhinitis. Let us see on
AI might create more millionaires in 5 years than the internet did in 20, disappear for a month, and do
The olfactory system is responsible for the sense of smell or olfaction. Basically, airborne molecules emitted by an odorant source are detected by olfactory sensory neurons located at the roof of the nasal cavity. These neurons convert chemical stimuli into electrical signals and send them via the olfactory nerve to the olfactory bulb, then to the brain, where they are interpreted as odors. Odorant molecules are first dissolved in the mucus secreted by the olfactory epithelium, which guides them to the cilia of olfactory neurons. This is where odorant molecules bind to their receptors. Each neuron expresses a single type of protein receptor. There are only about 400 different receptors in humans, but they are used in a combinatorial way.
There are 400 receptors are there.
Such that one odorant can bind several receptors, and one receptor can bind several odorants. This enables the olfactory system to recognize an enormous number of odorants.
10,000 human can recognize at least 10,000 odors. We know that only we think that we have a few odors we know. We can understand 10,000 odors.
Odorant receptors are G protein coupled. Upon binding to the odorant, a signaling cascade is activated, leading to membrane depolarization. When the olfactory stimulus is strong enough, action potentials are generated and conducted along the axon to the olfactory bulb. The axons of all olfactory sensory neurons form the olfactory nerve, also known as cranial nerve 1. In the olfactory bulb, these axons synapse with second-order neurons, the mitral and tufted cells, within structures called glomeruli. Each glomerulus receives axons from sensory neurons that express the same protein receptor. The second-order neurons are stimulated by sensory neurons, but they also receive inhibitory feedback from the cerebral cortex. This means an odor can be perceived differently under different circumstances. For example, the smell of food is more appealing when one is hungry and is less so when one is full. The axons of mitral and tufted cells form the olfactory tracts, which project directly to the primary olfactory cortex. The primary olfactory cortex is not one, but several cortical areas located on the base of the frontal lobe and inferior surface of the temporal lobe. These primary regions then project further to some other areas of the brain, mediating different aspects of odor recognition and response. Because olfactory neurons are exposed directly to the noxious external environment, they are replaced more often than other neurons. Stem cells in the epithelium differentiate into new olfactory neurons, whose axons grow along the existing axons to the olfactory bulb. Any factors that destroy all olfactory neurons at once would result in a permanent loss of sense of smell, a condition known as anosmia. Illnesses that cause inflammation of the nasal mucosa may lead to transient anosmia. Loss of smell also affects the taste experience, as taste and smell are the two aspects of flavor. The ability to smell decreases with normal aging, but anosmia is also an early sign of several neurodegenerative disorders. Because epileptic seizures often originate from the brain area associated with the olfactory cortex, seizures are often preceded by hallucinations of disagreeable odors.
Is it okay? So these are the functions happening inside the body. Do we know anything about it? These are all God's miracles. How many things, how many things happening inside our body. How many nerves are working, how many hormones are acting, how many chemicals are affecting our body, inside the body. But we don't know anything about it. Let us go to the other part. olfactory nerve damage causes symptoms and treatment. The olfactory nerve, also known as cranial nerve, is an unique sensory nerve responsible for the sense of smell. It plays a role in detecting and processing orders, allowing humans to perceive and distinguish various scents. Beyond appreciating pleasant aromas, smell acts as a warning system, alerting individual to dangers such as gas leaks, smoke, or spoiled food. This chemosensory process also influences memory and taste perception as much as of flavor is derived from smell. The memory of the smell. If I say that the smell of a flower, a rose, you can imagine, whenever I say this word, you can feel it. So the smell, we know that the smell of that. If we say that a decayed mouse is decayed there, or a decayed anything, that time the smell we remember the smell of that. That is another thing. What causes olfactory nerve damage? These are the main important things of olfactory nerve damage. Head trauma is a common cause of olfactory nerve damage. Injuries like concussions or skull fractures can directly damage the sinonasal tract or olfactory epithelium, or shear the delicate olfactory fibers as they pass through the cribriform plate, a bone structure separating the brain from the nasal cavity. This can impede their connection to the olfactory bulb, leading to smell loss. Conditions or hemorrhage in the olfactory cortex, the brain for issue inhibiting olfactory processing. Head injury or any other injury. Concussion means a few days back, I had fallen from a ladder, just cleaning my home. That time, in the morning time, I did not feel anything bad. But afternoon, I was very much disturbed and I could not even stand still. I was lying because I don't know what happened. Because of that fall, some concussions might have happened. But it is cured. The next day, it will become okay. So here we can fluid sinusitis. What are the smell disorders? People who have smell disorder either have a decrease in their ability to smell or changes in the way they perceive odors. Whenever the perception will not be in the right way. Hyposmia is a reduced ability to detect odors. Cannot understand. The ability diminished. Then anosmia is the complete inability to detect odors. In rare cases, someone may be born without a sense of smell, a condition called congenital anosmia. It is an important thing. It is a disease, may show it may lead to some other diseases, some fatal diseases or like that. Parosmia is a change in the normal perception of odor, such as when the smell of something familiar is distorted. I told you that case last time. I told you on girls. Or when something that normally smells pleasant now smells foul. That was the symptom. That is, plumbum medicine is the medicine. In that cases, plumbum medicine, plumbum metallicum is on important medicine for such cases. Parosmia. Phantosmia is the sensation of an odor that is in there. Sometimes some people may say that I have feeling that, but some the others will not say that, hey, we don't feel. But some people having some sort of, this is like delusions. Sometimes hallucinations. Yeah, it may be connected with psychology, psychiatry. What causes smell disorders? Smell disorders have many causes, with some more obvious than others. Most people who develop a smell disorder have experienced a recent illness or injury. Common cause of smell disorders are: 1, aging. That is why any food will not, they cannot enjoy the food because of they cannot get the smell of that food. Or spices. If there are spicy food, even though the spices will not, they cannot feel the spices, smell of the spices. Sinus and other upper respiratory infection. Upper respiratory tract infections may be one of the main reason for smell disorders. Smoking. Chronic smokers, because they are always smoking through their nasal orifices, they use their nasal cavities. So there may be additions of smoky. So they may have this type of problems. Growth in the nasal cavities. Growth may be malignant or acute, some sort of growth, and even nasal polyps may have that head injury. This is one of the cavity for this is a cyst. Hormonal disturbances. Hormonal disturbances. Almost all hormones, they're having the quality of the normal metabolism or like that. In that cases, hormonal disturbances may be dental problems, exposure to certain chemicals such as insecticides and solvents, numerous medications, including some common antibiotics and antihistamines, radiation for treatment of head and neck cancers, conditions that affect the nervous system, such as Parkinson's disease and or Alzheimer's disease. Sometimes, I told you that sometimes it may lead to that cases that we can go through that. What are research? So where there are research methods are that promote the regeneration of the sensory nerve cells. We know that during the time of COVID, most of the people having the symptom of anosmia, it all regained. We have medicines. We will go to that medicines later. Promote the regeneration of sensory nerve cells. Understand the effects of environment, such as gasoline, these are all, or smell or taste. Prevent the effects of aging or smell and taste. After 65 years, or in Alzheimer's disease and Parkinson's diseases are coming during the time, so that they may have loss of smell, develop new diagnostic tests for understand the association between smell disorders and changes in the diet and food preferences in the elderly or among people with chronic illnesses. That is why they say that tasteless food are tasteless. So we should not rebuke them, because we may think that they are just saying to criticize others. Not. That is because of the disability. Here, otitis media, it may be affect the otitis media, chronic or normal. Here, the infected one. The ears, I told you that ASM, acute suppurative otitis media, or CSM, chronic suppurative otitis media. Best medicine, I told you that, Silesia ona. Viral infections are another frequent causes. Viruses, including those responsible for the common cold, influenza or SARS, can attack COVID-19. The cranial nerves related to smell or the surrounding mucosal tissue. This was one of the confirmatory tests for us to during the time of COVID. We experienced it and we cured it. Thousands of cases we cured it. So we got an we know that we should think that after only in Kerala, all schools are opened after giving them arsenic alba. Then it is not stopped till now because COVID was controlled by we people. That is a great thing. We people controlled. I told you in the former classes that in Italy, thousands were killed. We know that due to the COVID time, thousands were killed. They are carried by JCBs and they are putting big, and they are cremated, not cremated, they are all buried, big. And so that time, COVID was controlled by some Cuban doctors. What they used, the Cuban doctors were used homeopathic medicines. 5-6 medicines. What we are using the medicines we are normally using medicines are they used for to control the COVID. Within a month, they cleared it. After that, only in Italy, it was controlled. Our Jawahar Shah, Dr. Jawahar Shah told in our platform that within 2 weeks after giving arsenic alb, they could control in Bombay and Dharavi or somewhere. Neurological conditions also contribute to olfactory nerve issues. Neurodegenerative disorders such as these are degenerative diseases, neurodegenerative diseases, frequently present with impaired smell and often appearing before other symptoms. Multiple sclerosis can also cause olfaction. I want to show one thing. I told you that girl, she told me that previously she liked some smells. After that, she could not stand the smell of what she liked in the previous time. For the academic purpose, I had taken her picture of her hands. Do you understand anything? I used to study palmistry. Here, in palmistry, they say that this is the line of heart. Here we can see that line of heart is Paka, almost Paka. Here we can see that these are all line of head. These 2 photos are of her. Line of head. Here we can see that line of head is like this. It is originating from here. It is coming to here. I normally, sometimes in some cases, you cannot understand that what was the problem. That time I just go there. I go through this something for the morphological stage. Because here, these are all broken line of head. I asked her what is her conditions or any other psychological problems or anything like that she's having in the previous time. She told me that she is having fit, epilepsy, petit mal, not grand mal, petit mal. Several times she had, and the line of head is like this. Broken line of heads and heart. Left hand and right hand. Here the heart lines are okay. Her heart, they says that in the palmistry, they says that the left hand shows the normal. They whenever they are born and they have the line will be as their hereditary lines there may be. After leaving, if they are living difficult in different types, if they are against, some people are against their life and they will lead some different types of life. That time the line will be changed. One person here we can see that her in the while she was her left hand, here the broken lines. Heart line is broken. Here we can see that the line is okay. That means that in the previously she had some heart complaints, heart line is broken, and here we can see that the heart is becoming strong. Here her line of head is broken, and here some changes may have. Here we can see that this is the line of head. Palm is to say that the line of head. Whenever this line of head coming here, there is chances of lunacy. You check it. I watched many cases. If they are coming here, it is going up and up, they will be very much practical in their life. That may change. The natural, there may be a natural tendency. It may change. If you are leading a strong life, that time the lines, the right hand lines will be. That is why, because most of ladies left hand are studying that palmistry because they may have the natural qualities. And some girls may lead a strong life, then their right hand will be changed in a lot. Here the line, we can say sometimes the line may be in the previous time, here when he was here, it is coming to here means that there will be more imaginating type, more imagination they may have. Here coming, they are very much practical and adamant and doing things strong in their activities. I think that within this is good between the both. Sometimes here we can say that if the line is starting from here to here, from here to here, that means that they are very independent in their thoughts. They are very independent people. They will not hear others, what others say. They will go into the same thing. It may be a right thing or it may be a wrong thing. They will be very much adamant in their activities. But some people are having from here that they will accept the others' words and they will hear, they will think it over again and again. They will think that they are trying to understand the things and they will try to discern what are the things are saying and is it possible or is it impossible, and they will study the reality. They will understand, they will try to understand the reality. So we can go to some medicines. Syresia. Silesia, nose, itching at point of nose, dry hard crust form, bleeding when loosened, nasal bone sensitive, sneezing in morning, obstructed and loss of smell, perforation of septum. The nasal septum will be perforated in cases. There we can use silesia. Then comes nose. Kali iodate. This is the number one medicine. So kali more can be used well. That is why we are using this medicine in tissue remedy. Here, nose red, swollen, tip of nose red, profuse acrid, hot, watery, thin discharge. Sina with perforated septum. Perforations, they will not be complete perforation, but certain scratches or damaged septum may get using this medicine. Sneezing, nasal catarrh involving frontal sinus, stiffness and dryness of nose without discharge that we have seen where obstruction of the sinuses. Profuse, cool, greenish, unirritating discharges. Here, whenever we are using different potencies, the potencies may be, sometimes it is obstructed. In some cases, there may be, they may open that, clear that path. Here, syphilitic eyes also involved conjunctiva red, injected profuse lacrimation, syphilitic iritis, pustular keratitis and chemosis, bony tumors of the orbit. Here, kali iodate. Next coming, pulsatilla. I told you. Coryza stoppage of right nostril, pressing pain at root of nose. These medicines can be used. Generally, we can use for any case of nasal block or nasal, there is allergic towards many things. Allergy towards pollen grains or any allergies, general allergies, we can use pulsatilla. In all potencies we can use. Loss of smell, large green fitted scales in nose, stoppage in evening, yellow mucus, abundant in morning, bad smells as old catarrh, nasal bone sore. Here we can think about pepper sulf also. Pepper sulf. Oh yes. Pulsatilla, then hyposmia. I told you partial loss. Your sense of smell helps you enjoy life. You may delight in the aromas of your favorite spicy foods or the fragrance of flowers. If it is lost, means you will, the enjoyment you will not get. Your sense of smell is also a warning system, alerting you to danger signals such as gas leak, spoiled food. Whenever cooking, that time, if it is badly spoiled, then we can understand it. Any loss in your sense of smell can have a negative effect on your quality of life. Your quality may be changed. So it is a general symptom. General symptom. It may affect the whole body. So it is a general symptom. It also can be a sign of more serious health problems. Diseases of olfactory nerves, is neurodegenerative diseases, already discussed, allergic rhinitis, olfactory nerve tumors, and respiratory infections. These are the signs and symptoms of damage. Olfactory nerve damage can manifest in several ways, impacting an individual's perception of scent. They cannot understand, they can distinguish what smell is they have. Anosmia referred to the complete inability to detect odors. Anosmia, complete. Sometimes it will last forever. This condition can be congenital or develop later in life. When anosmia occurs, the entire spectrum of smell is absent, which can diminish the perceptions of food flavor. How to regenerate it? We already concluded many things. I believe that we should have faith that we can clear it. Good smell. Life will be beautiful if we are enjoying the smell of good odors, thinking about it. Whenever we have a smell, we will, if we are traveling some areas in like that Wayanad or Idiki, sometimes there is, we can hear, everywhere we can have the smell of pepper, ginger, coffee. That area itself is a beautiful area. That is why we say that these are the beautiful areas. We will go there, travel through that area, we will have the smell. Whenever some places, whenever we are going through, there is only foul smelling or the smells of the toilets and everything. That time there, whenever we are thinking about that place, we will have some nausea. So that is another thing. So we have to make our life beautiful. Hypoxia. Parosmia involves a distorted perceptions of odors, where familiar smells are altered or perceived as unpleasant. For example, coffee might smell foul or chemical-like. This distortion occurs when some olfactory nerves are only partially working, leading to an incorrect combination of activator receptors. I told you that times 1,000 orders we are day to day we are. So I am stopping here. So you have anything to ask, please. Thank you, Mom.
Thank you, doctor. Thank you so much. Actually, it is a detailed explanation and all the pictures, everything was very good, and the explanation also very nice. And we have only 3 minutes. If anyone wanted to ask something, you can raise your hands and ask a question to Dr. Hubert. I think there is no questions. And
Are they sleeping?
and Dr. Hubert.
It's doctor. It's really a very good session.
Yeah. Actually, he's a Sagalagala Vallaban. Now he's talking about the palmistry even. Learning new things and analyzing the disease through with many angles. Actually, it's a good job through music, through palmistry. You're touching all the parts of cure and healing.
No,
And Dr. Ram Parvesh, what Dr. Danesh?
Dr. Bob is waiting.
Yeah, Dr. Bob Lim, you can please. Dr. Bob Lim, you can talk now, please.
Me? Okay. Today is a very special subject that Dr. Hubert shared, and it's always share very interesting subject. And he always started with the prayers, and that's very good, and sharing some knowledge of God and everything. Then also he will start with the anatomy and physiology, I think it's very good because it's very detailed and it also refreshes our memory back to anatomy. Like I'm taking a lecture class now in the college, but it's very good. Specified the cranial nerve with the connection to the olfactory nerve and the also you mentioned about otitis and that's a very good information. And also finally we also waiting for the remedy for the treatment and you also share with it, and that's very good. Thank you very much, Dr. Hubert. I think Dr. Ram
Thank you, Dr.
is smiling. Okay.
Thank you, doctor.
Okay, thank you, Doctor.
Dr. Ram Parvesha, during our college days, no one explained like this. They have only they are explaining. They are not giving the complete knowledge, and they are not explaining in such way. They are simply following their notebooks and giving some lectures. Okay,
Because
Dr. Ram
Parvesha. That time nothing was there. But nowadays it is science is developed, everything we can see.
Exactly,
That is what.
Dr. Ram Parvesha, you can talk now, and we'll hand over to.
Thank you, Anjali. Our congratulations,
Thank you.
Dr. Hubert SILVA. Very good and deeply describe the cranial nerve neurological disorder. Cranial nerve is a very important nerve and damage of cranial nerve many manifestations the disease, cause of disease, deafness, etc. So very thanks, Dr. Hubert Silva. Time is short.
Thank you, sir.
Thank you, sir. Thank you. Thank you so much. Thank you, Dr. Hubert, and thank you everyone for joining with us. Now we are moving to the next session in our local language, Malayalam. Thank you, everyone. Please participate in all the webinars. If you are not able to participate in the webinar, it is available in the YouTube. Please watch the YouTube videos and please subscribe it. Thank you so much. I'm inviting Dr. Mariamma John for moderating Malayalam session. Dr. Hubert, please make Mariamma John, Dr. Asen.
Okay, I shall do it.